channel again. This is Isa for Dating Tips for Success. We're back again with another video. And for today, we will talk about what are the 22 pros and cons of dating a nurse. So, of course, we all know that nurses are really great at taking care of a person, but they also need time to take care of themselves. So, whenever you date a nurse, you also have to um, think about her and see what is she feeling, if she's still okay or not, and you also have to be there for her. So here are the pros. Number one is they can be the best solution for your headache and most cute emergency treatment supplier around. So she knows what are the medicines that you can take and what are the things that you can do to make yourself feel better. Number two is you won't hear EO when they see blood or sickening body liquids. So since they are used um to those types of situations and events, they know how to handle those things. Okay. Number three is they won't be disturbed by your cans propensities. So you don't need to profess to be Mr. or then again Miss Impeccable when you love a nurse. So they have seen all of the defects of a person. They have seen all of the attitudes and you don't need to pretend when you are in front of them. Number four is they can be your very own Google or clinical word reference. So since they study about medicine, they know the terms, they know the symptoms, signs, and the things that you can do to make yourself feel better, especially when you are sick or when you are feeling not yourself during the day. So yeah. Number five is they are incredible audience members and advisors. So of course they are not robots. However, they always listen and give medicines and assistance and help that they can give all. So they are sympathetic person, so they usually understand where you're coming from, especially when you are upset. Number six is treat you when you are debilitated. So whenever you have you're sick or you need to go to emergencies or you're not feeling well, they're always there to be with you and take care of you. So number seven is mindful. So they are usually prepared to think about the wipeout and so on. So most of the time they are attentive with whatever they are doing and they handle since they are handling different types of patients and a lot of patients every day, so they know how to deal with a problem or with an issue. So eight is dating a nurse implies resistance. So they can endure all the garbage from a patient. So they can accept anything that your stomach can't. So yeah. Nine is kind and humane. So they are really great in sympathy and empathy. So since they are usually understanding and caring for their patients, most probably that attitude they will carry it towards the relationship. 10 is experience a great deal of worry at work. So they know how to handle time, they know how to handle pressure, they know how to handle. So it's really impossible for a nurse to rest a day with the whole day. So what you can do is, yeah, just take care of her. Okay. 11 is be thankful if you are dating an attendant. So you also have to be thankful. They give you everything, they give you all the care and love that they can do. So a simple thank you will be enough. 12 is won't generally have them home. So most of the time they are not home. They are not staying at home, and most of the time more than they work hours more than what we work. So 13 is never attempt to make them extremely upset. So don't try to make them upset since they are really tired. So yeah, they can understand you, but not to the point where all of their patience is gone. 14 is they are not terrified of blood. So yeah. 15 is great communicator since they usually face different types of people and patients. So they know how to connect with people calmly. So 16 is their normal guardian. So they usually tell you what is bad for you and what is good for you. So you just have to be accepting with that. 17 is what's more or sympathetic. So they truly worried about you when they say they are. 18 is try to avoid panicking. So attendants realize how to think judiciously during an emergency. So you also have to calm yourself. 19 is three letters CPR, so they know how to do it. So whenever you're not feeling good, whenever you feel like you're choking, so they know how to handle you. 20 is nurses or acceptable audience members, so they usually is okay in listening to you. So you before I, so that is their motto, and um, usually they don't think of themselves and they don't care about themselves anymore. 22 is one extreme treat. So yeah, they're really intense and they can they can take care of themselves, they can take care of other people, and yeah. So here are the cons. Number one is person consideration. So yeah, they can become sick and also awful with some points, but they're really understanding. Two is their work friends are their family. So since they work extra and longer hours, so their friends became their family, and most of the time they are staying at the hospital and not at home. Three is who write extended periods of time and inverse timetable. So you also have to be patient with her work schedule. So she works more than what what we work, and most of the time her shift changes from time to time. So don't be shocked if she just went home and then suddenly she was called. Four is our home needs a specialist or sanitizer. So you also have to take care of yourself and at home. So you also have to sanitize everything in your home and stay healthy. Five is the duration of for espresso has expanded extraordinarily. So she likes coffee. Like it's her way to be awake, to wake herself every day. So six is your prostrate joke isn't interesting. So every medical jokes are not a joke for them. So you also have to be considerate with those. Seven is truly we have net anecdotes about pretty much every body part you could envision. So yeah. Eight is we're really gazing at your veins and not your muscles. So they are looking at your veins instead of your muscles in case you think that most of the time they stare at your muscle. Number nine is at the point when we get back home, we're bouncing in the shower and then that's it. So most of the time they just went home just to have a shower and a quick nap. So 11 is we will gumble about our activity, however we love it. So most of the time they tell you what's happening. Um they always say awful things about work and so on. However, they can't say no with their work. 11 is kindly absolutely never asked for what good reason we didn't turn into a specialist. So please don't ask them why they aren't doctors, because they love being nurse, they love taking care of the patients. So 12 is we perform multiple tasks, yet when you need us we're completely there. So they can multitask, they can do anything. So but The problem is, so they're always there for you. So please don't take advantage of them. 13 is we're fit as a fiddle. So we run from one and then to the other one, and then yeah, that's our life. That's our daily routine to move from one patient to another patient. So you also have to be okay with that they are facing different types of people with different sickness. 14 is, while regarding the matter of going around, it would be ideal if you give us a foot rub. So try to give them a foot massage, or just do something nice for them, like um giving them their slippers when they get home, cooking them their food, their dinner, their breakfast, and so on. So yeah, 16, toward the finish of an 8-hour move, we need somebody to deal with us. So since they are really tired of their work, so you also have to be there to take care of them. 17 is we rise early or we work throughout the night. So it's just that they wake up so early or they work at night. So most of the time you won't see them at home. 18 is when we get back home late and are too drained to even think about cooking. So um they have no time to cook for them own food. So might as well cook for you. So you also have to know how to cook or how to make food, so that when she comes home, there's a food for her and she will appreciate it the most. 19 is we work extra, since we know there are wiped out people who need us. So they work so much. Overtime hours is okay, it's normal for them. 20 is we miss end of the week occasions or birthday events. So they don't have holidays, they have no birthday leaves or so on. So most of the time you won't see them and they won't be there, and most of the time they forgot about it. 21 is we would prefer not to move when we get back home. So since they are tired of the 12-hour shift and sometimes 16-hour shift, they just want to lay in bed and just rest. 22, it might appear that we have left the entirety of our mind, our heart, and our duration at work. At that point, have returned home to your vacant. So it doesn't mean that they are off the clock. They can relax. So they also need to rest and yeah, catch up with the sleep that they haven't gotten for days. So yeah. Again, this is Isa for Dating Tips for Success, and we hope to see you in our next video. Goodbye.